President Biden is set to deliver remarks this morning on the federal COVID response. Joining me now for more on the president's plan, Chief Innovation Officer, Boston Children's Hospital, and ABC News medical contributor, Dr. John Brownstein. I guess first, let me ask you what you think about Boris Johnson there. I mean, sticking to the rules, you know, when you're the prime minister, you've got to lead by example. It's not the first time that we have seen leaders, politicians, breaking their own rules.
Yeah, we've seen this time and time again, and it's unfortunate because, you know, we are asking a lot of the American people to get behind really challenging times, social distancing, masking, you know, we're dealing with closures, you know, really upending people's lives in all sorts of ways. So we need that example set by our leaders if anybody's going to get on board. And otherwise, it's just going to really sort of tell people that they can just, you know, follow whatever rules they feel like. So, yeah, we need to expect more from our leaders.
All right, let's talk about the president's remarks today, as I know we're going to talk after he speaks as well. He's expected to announce all these details about more deployments of military medical teams to hard-hit states. What kind of impact do you think this is going to make, John? And is Biden's plan enough, or is it just a little too late here?
Well, you know, we're in the middle of a surge right now, and that's, you know, nothing we can do right now will change that. But, you know, our hospitals are under significant pressure. I have fellow colleagues across the country that are dealing with challenges, especially in the ED. I know we spoke earlier about the fact that Omicron is less severe, but that doesn't change the fact that our hospitals are just getting overwhelmed, and that denominator of infections is causing huge strains, not to mention the fact that we have so many of our healthcare providers that have left the workforce or are sick in isolation. So much strain. And, you know, we've spoken about this for 2 years. We're trying to flatten the curve. We are not doing a good job of flattening the curve right now. So yes, those resources will help. It probably isn't enough because we're dealing with surges across the country, and it's not going to fix the structural issues of our health systems, which we need to take a much closer look at. And whatever we can do now to keep transmission down the community, so rapid tests and making sure that we're limiting our mobility, that will ultimately also help our health systems right now.
All right, John Brownstein, Doc, thanks so much. Stay with us because the president is expected to speak in about an hour and 15 minutes or so. We'll take it live and we'll talk again. Thanks, John.